Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Ramsha Mushtaq Khan, and today I have the opportunity to present on the topic Total Quality Management under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: quality means doing it right when no one is looking. Content outline: we will discuss total quality management, its introduction, analytical tools and techniques, implementing total quality management in healthcare, primary elements of total quality management and Deming's model, and recent advances and multiple choice questions at the end. At the end of this presentation, the participants will be able to define total quality management, TQM, and its key principles, learn common TQM tools and techniques, understand how to implement TQM in healthcare settings, recognize benefits and examples of TQM programs, appreciate the global recent advances in the context of TQM. Starting my presentation, I would like to name various total quality management techniques as shown in the figure. Number 1 is total quality management. Number 2, Six Sigma. Number 3, top-down and bottom-up approach. Number 4, ISO certification. Number 5, cost of quality. And number 6, CASM. Today, we will discuss the first type of quality management techniques, which is the total quality management. TQM is a participative, systematic approach to planning and implementing a continuous organizational improvement process. Its approach is focused on satisfying customers' expectations, identifying problems, building commitment, and promoting open decision-making among workers. Analytical tools and process techniques in total quality management. TQM applies analytical tools such as flow and statistical charts and check sheets to gather data about activities within an organization. TQM uses process techniques such as nominal groups, brainstorming, PDCA cycles, and consensus forming surveys to facilitate communication and decision making. The analytical tools, for example, flowcharts, are used to visualize and analyze processes to identify areas for improvement. Statistical processes are used to measure current performance as a baseline for improvement. And analytical techniques, for example, brainstorming, is used to generate ideas for improving processes. PDCA cycle, plan, do, check, and act cycle, is to plan and test a change in idea, gather data on what worked or didn't, and iterate through additional cycles of improvement. Surveys are used to collect data to make fact-based decisions. Implementing TQM in public health. TQM has a right on the health services paradigm, or at least in parts of the health services system. The Joint Commission on the Accreditation of Healthcare Organizations, for example, have incorporated TQM concepts in its agenda for change. The American Hospital Association, through its Hospital Research and Educational Trust, has published a report to help hospitals design and implement TQM. Consulting organizations have developed programs to educate health services, managers, physicians, and other health personnel on TQM. The increasing use of TQM is an exciting development, but TQM application lags in the process of providing health services in the public sector, specifically public health agencies. TQM offers public health organizations a unique opportunity to adopt a powerful tool for strengthening management and presents a fundamental challenge to public health administrators. The potential for TQM as major managerial innovation compared with the current management of many public health agencies and guidelines to help users realize its full potential in public health applications will be discussed in this presentation. TQM requires that change be based on the needs and desires of patients, clients, and health personnel involved in the entire work process and possibly across programmatic areas. Standards and assessment. Standards in the practice of public health traditionally emphasize on number 1, health outcomes, number 2, flexibility to allow communities to establish and quantify their own objectives, and number 3, the role of government as a residual guarantor that is responsible for assuring that prevention services are provided through community agencies. Apex PH Assessment Protocol. The recent development and availability of the Assessment Protocol for Excellence in Public Health, Apex PH, provides a methodology for systematically assessing departmental operations relative to meeting standards. It provides agency leaders a clear, comprehensive, and flexible protocol for assessing organizational and community resources and needs. It helps to meet national health promotion and disease prevention objectives at the community level and provides health agencies with a rational method to assess their potentials and goals for health outcomes. Guided by community health objectives and assessment findings, managers can formulate an agency community health plan that could serve to direct work within programmatic areas. The organizational assessment process provides us framework for developing and maintaining the capacity to carry out a community health plan to assure that program objectives are met instead of relying on the traditional performance standards and quality assurance methods. TQM offers a means to improve the ongoing processes and to enhance agency performance within a changing environment. TQM focuses on work processes and applying analytical and behavioral techniques to improve these processes within an organization. For example, a group of nursing and laboratory personnel may select a process for improvement, such as untimely deliveries of laboratory test results to a prenatal clinic. Using a series of flow diagrams, they may be able to identify the steps involved in the process and the factors that may be contributing to delays. Based on this understanding, the group may be able to identify and try steps to improve the timeliness of the test results, monitoring the results to try to achieve continuous improvement. Redefining public health performance in such an application, TQM presents a fundamental challenge to the use of internal performance standards to achieve public health objectives. While the use of performance standards can be a starting point for TQM, continuous quality management goes beyond conforming to management standards. TQM includes a systematic analysis of the work performed by the organization with the emphasis on the horizontal integration of services across program areas. TQM can be summarized as the management system for a customer-focused organization that involves all employees in continual improvement. It uses strategy, data, and effective communications to integrate the quality discipline into the culture and activities of the organization. The primary elements of TQM. There are 8 primary elements. Number 1 is focus on customer. Number 2, employee involvement. Number 3, process-centered. Number 4, integrated system. Number 5, strategic and systematic approach. Number 6, decision-making based on facts. Number 7, communication. And number 8, continuous improvement. We will discuss them one by one. Number 1 is focus on customer. The customer ultimately determines the level of quality, no matter what an organization does to foster quality improvement. Training employees, integrating quality into the design process, or upgrading computers or software, the customer determines whether the efforts were worthwhile. Employee involvement. All employees participate in working towards common goals. Total employee commitment can only be obtained after fear has been driven from the workplace, when empowerment has occurred, and when management has provided the proper environment. High-performance work systems integrate continuous improvement efforts with normal business operations, and self-managed work teams are one of the form of empowerment. Process-centered, a fundamental part of TQM is a focus on process thinking. A process is a series of steps that take inputs from suppliers, internal or external, and transforms them into outputs that are delivered to customers, internal or external. The steps required to carry out the process are defined, and performance measures are continuously monitored in order to detect unexpected variation. Integrated system. Although an organization may consist of many different functional specialties, often organized into vertically structured departments, it is the horizontal processes interconnecting these functions that are the focus of TQM. Microprocesses add up to larger processes which aggregate into the business processes required for defining and implementing strategy. Everyone must understand the vision, mission, and guiding principles, as well as the quality, policies, objectives, and critical processes of the organization. Business performance must be monitored and communicated continuously. An integrated business system may be modeled after the Barlage Award criteria or incorporate the ISO 9000 standards. Every organization has a unique work culture, and it is virtually impossible to achieve excellence in its products and services unless a good quality culture has been fostered. Thus, an integrated system connects business improvement elements in an attempt to continually improve and exceed the expectations of customers, employees, and other stakeholders. Strategic and systematic approach. A critical part of the management of quality is the strategic and systematic approach to achieving an organization's mission, vision, and goals. This process, called strategic planning or strategic management, includes the formulation of the strategic plan that integrates quality as a core component. Fact-based decision making. In order to know how well an organization is performing, data on performance measures are necessary. TQM requires that an organization continually collect and analyze data in order to improve decision-making accuracy, achieve consensus, and allow prediction based on past history. Communications. During times of organizational change as well as part of day-to-day operation, effective communications play a large part in maintaining morale and in motivating employees at all levels. Communications involve strategies, methods, and timeliness. Continual improvement. A large aspect of TQM is continual improvement, continual process improvement. Continual improvement drives an organization to be both analytical and creative in finding ways to become more competitive and more effective at meeting stakeholder expectations. These elements are considered so essential to TQM that many organizations define them as a set of core values and principles on which the entire organization is to operate. Deming model of quality management. Deming's 14 points of total quality management include: Number 1, create constancy of purpose for improving products and services, adopt a new philosophy, cease dependence on inspection to achieve quality, minimize total cost by working with a single supplier, improve constantly and forever every process for planning, production, and service, institute training on the job, adopt and institute leadership, drive out fear, break down barriers between staff areas, eliminate slogans, exhortations, and targets for the workforce, eliminate numerical quotas for the workforce and numerical goals for management, and remove barriers that rob people of pride of workmanship, and eliminate the annual rating or merit system. Institute a vigorous program of education and self-improvement for everyone, and put everybody in the organization to work accomplishing the transformation. These total quality management principles can be put into place by any organization to more effectively implement total quality management. As a total quality management philosophy, Dr. Deming's work is foundational to TQM and its successor quality management systems. Benefits of total quality management. The emerging behavior of business system depends upon feedback, and feedback continual improvement, plan, do, at study cycle, and organizational learning. Number 1, strengthen competitive position, adaptability to changing conditions and government regulations, higher productivity, enhanced market image, elimination of defects and waste, reduce costs and better cost management, higher profitability, improve customer focus and satisfaction, increase customer loyalty and retention, increase job security, improve employee morale, and enhance stakeholder and shareholder value. TQM can be integrated with number 1, Lean, number 2, Six Sigma, number 3, Balanced Scorecard, and leverage using technology and adapted for emerging care models. Now it's time for recent updates. According to the American Society of Quality, ASQ, the generic strategy model for implementing TQM systems include: top management learns about. Number 1, top management learns about and decides to commit to TQM. TQM is identified as one of the organization's strategies. Number 2, the organization assesses current culture, customer satisfaction, and quality management systems. Number 3, top management identifies core values and principles to be used and communicates them. Number 4, a TQM master plan is developed on the basis of steps 1, 2, and 3. Number 5, the organization identifies and prioritizes customer demands and aligns products and services to meet those demands. Number 6, management maps the critical processes through which the organization meets its customers' need. Number 7, management oversees the formation of teams for process improvement efforts. Number 8, the momentum of the TQM effort is managed by the steering committee. Number 9, managers contribute individually to the effort through washing planning, training, coaching, and other methods. Number 10, daily process management and standardization take place. Number 11, progress is evaluated and the plan is revised as needed. And number 12, constant employee awareness and feedback on status are provided and a reward or recognition process is established. Examples of total quality management system strategies. Imprints of TQM concepts can be found in modern approaches to quality management, such as the Malcolm Baldrige National Quality Award, ISO 9001, and Six Sigma and Lean Manufacturing as the examples shown below. Total quality management implementation strategies. Number 1 is the TQM implement approach. The TQM implement approach takes key business processes or organizational units and uses the tools of TQM to foster improvements. This method was widely used in the early 1980s as companies tried to implement parts of TQM as they learned them. Examples of this approach include quality circles, statistical process control, Taguchi methods, and quality function deployment. Strategy 2, the Guru approach. The Guru approach uses the teachings and writings of one or more of the leading quality thinkers as a guide against which to determine where the organization has deficiencies. The organization makes appropriate changes to remedy those deficiencies. For example, managers might study Deming's 14 points. Afterward, they would work on implementing the approach learned. Strategy 6, the organization model approach. In this approach, individuals or team visits organizations that have taken a leadership role in TQM and determine their processes and reasons for success. They then integrate these ideas with their own ideas to develop an organizational model adapted for their specific organization. Strategy 4, the Japanese total quality approach. Organizations using the Japanese total quality approach examine the detailed implementations, techniques, and strategies employed by Deming Prize-winning companies and use this experience to develop a long-range master plan for in-house use. And strategy 5, the award criteria approach. When using this model, an organization uses the criteria of a quality award, for example, the Deming Prize, the European Quality Award, or the Malcolm Baldrige National Quality Award to identify areas for improvement. Under this approach, TQM implementation focuses on meeting specific award criteria. Now it's time for the multiple choice questions. Number 1, the district health department in rural Sindh wants to improve the quality of its immunization services. The TQM tool that would help analyze the current immunization process and identify areas for improvement is number 1, benchmarking, number 2, statistical process control, number 3, flow charting, number 4, PDCA cycle, and number 5, brainstorming. So the answer is C, flow charting, to identify the key areas of improvement. A public health hospital in Lahore formed a quality improvement team to reduce waiting times in its outpatient department. The team can use one of the following TQM techniques: A, benchmarking, B, brainstorming, C, statistical process control, D, surveys, and E, flow charting. So the answer is B, brainstorming. The Lady Health Worker program in Balochistan has noticed declining patient satisfaction with its services. To improve quality, the program plans to implement TQM. Of the following, one not a key principle of TQM is A, employee involvement, B, continuous improvement, C, central leadership, D, customer focus, and E, process orientation. So the answer is C, central leadership. A rural health center in South Punjab wants to improve its tetanus toxoid vaccination coverage among pregnant females. As part of a TQM program, the health center measures its current immunization coverage by A. Surveys, B. Flow charting, C. Benchmarking, D. Statistical process control, and E. Brainstorming. So the answer is statistical process control. A tertiary care hospital in Islamabad implemented TQM to improve the quality of care. After 6 months, the hospital noticed an increase in patient satisfaction scores. This demonstrates the benefit of TQM. A. Increased costs. B. Improved processes. C. Decreased efficiency. D. Enhanced patient satisfaction. And E. Reduced staff morale. So the answer is enhanced patient satisfaction. A government hospital in Peshawar is implementing TQM. Doctors are resistant to changing their clinical practices. What should leadership do to gain staff commitment? A. Provide rewards. B. Drive out fear. C. Listen to concerns. D. Enforce new processes. And E. Provide training. So the answer is drive out fear. B. A district health unit in Kasur wants to reduce medication errors. As part of their TQM program, they established a quality improvement team. Who should be part of this team? A. Managers, B. Doctors, C. Pharmacists, D. Relevant staff, and E. Consultants. So the answer is D. Relevant staff. A primary healthcare clinic in Quetta wants to improve childhood immunization rates. They plan to conduct regular audits and reviews as part of a TQM program. The TQM concept illustrated is A. Strategic planning, B. Continuous improvement, C. Benchmarking, D. Change management, and E. Central leadership.
D.
The answer is B. Continuous improvement. The regular audits and reviews are the part of continuous improvement. A government hospital implements TQM to improve operational efficiency. Staff are trained to use flowcharts to analyze processes. The purpose of using flowcharts is A. Statistical analysis, B. Outline the sequence of steps, C. Compare against competitors, D. Identify root causes, and E. Process re-engineering.
B.
Yes, the answer is B. Outline the sequence of steps. A community health center notes decreasing patient visits over 3 months. As part of their TQM program, they survey patients on their satisfaction. The TQM element represented by the patient survey is A. Strategic planning, B. Leadership commitment, C. Continuous improvement, D. Fact-based decision making, and E. Change management.
D.
Yes, the answer is D. Fact-based decision making. So this is the key of the MCQs. Please like and subscribe our YouTube channel, and thank you very much.